Posadas, who it looks like she already had a couple virtual empanada.
You're making my mouth watery.
Yeah, it's a good scent to have in your mask. Lillian, light stuff aside, very, very sobering weekend at the Guam Memorial Hospital in terms of the COVID-19 virus and the battle that's raging there under your watch. So if you could, we just get right into it. Give us the latest numbers, census at the Guam Memorial Hospital.
Sure. This morning, our census is at 59. Of the 59 individuals in the house, 11 of them are at the ICU level of care. And of the 11, 3 of them are on ventilator support. The others are on either high flow nasal cannula oxygen, supplemental oxygen, or either BiPAP or CPAP, just to, again to augment what they need in terms of oxygenation into their system. And so, that's where we stand right now. We also have some individuals in the emergency room being seen and being evaluated. There are 6 of them who are COVID positive individuals. And so the doctors are trying to see to determine if they need to be admitted or can be released home to home isolation or to the ISOFAC. So there are 6 individuals in the emergency room.
Lillian, did you hear there's a waiting list for the ISO facilities? Is that hampering at all you guys' ability to transfer patients from GMH to the ISOFAC, which is currently full, and they do have some dirty rooms that need to be cleaned. So they're in the process go ahead.
Yeah, well, if anything, we do have the SIF. So, we have 6 individuals there right now. All in all, since we started moving and transferring patients to the SIF, there were about 25 total that have been moved over there. Most of them have gone home, and some have gone to the ISOFAC. But if we're not able to, discharge to the ISOFAC, then we will get them over, keep them at SIF, or from the emergency room, they go to SIF. So that's what we have as an option if the ISOFAC is full.
Can you provide an update? I remember when we spoke with you last time, you mentioned that you were expecting some staff to fly in on Sunday.
Yes, unfortunately, they didn't make it on Sunday, but they're coming in on the 22nd. I guess something with their travel arrangements with the company. So they did not arrive last night, but they are arriving on the 22nd is what the confirmation date that we were told as of Saturday when we had a conference call with them.
And all nurses?
10 nurses, 10 ICU nurses are arriving. Yes. And then the following week, the 27 or the 29, additional nurses, I think 10 or even possibly 20, who are at the level of practice progressive care unit or telemetry. That's what we've requested.
From Staffing Solutions?
Yes, ma'am.
Okay.
From the Staffing Solutions, yes. Uh-huh.
Wow. So 10 plus the 27 for 30.
No, 20 plus a 20 who are arriving on the 27th or the 29th.
Oh, okay.
So that's an additional of 30 nurses that we could certainly, use to help us out with our situation, especially in anticipation for, further increase of hospitalization.
I wanted to follow up on the patient that you had told us about. I think it was a couple weeks ago. This was a pregnant COVID-19 positive patient who sadly had lost the baby in utero. Has there been any development with this patient's case that you're able to share with us, of course?
I'm going to try and defer not to discuss any further on that situation, on that case, but the individual is still in the hospital, and that's all I can say. So I don't, get drawn into saying more information when I really shouldn't have to. I shouldn't. Right. Just again to respect the wishes of the patients, plus HIPAA. Right. I just need to make sure I stay in line with that. I don't get detracted off that track of HIPAA regulations. So that's all I can say.
What about any more newborns brought into GMH or tested positive?
We have the 2 who were with us. They're released home. We do have a 10-month-old who got admitted, and so we have a 10-month-old.
Okay.
What are you hearing about the nature of the exposure of these infants to the virus? Are they getting it from the parents or? Do you know?
Well, we can't say. I mean, if the parents are positive, and so of course they have to take care of the infant, and they can't keep social distance with the infant. Somebody has to take care of the infant, and so as much as possible, we instruct them that someone in the household who is not, can keep them isolated away from them, or they go to the ISOFAC. So the exposure is very high for infants, especially if the parents are COVID positive.
All right. Thank you, Lillian. Was there anything else you wanted to?
And any more staff catch
Okay.
the COVID since the last time we
Not
spoke?
knock on wood, let's not jinx, not recently, not in the last couple of days. The last one was, I believe, the 12th of October, one RN who tested positive. And oh, wait a minute, there was another RN who tested over the weekend positive. I think Friday, one RN. So that's one additional RN staff.
Are these local staff or are they hires from the solutions company?
They are our local staff. They are our organic staff.
Lillian, your staff, I mean, we thought 40 hospitalizations was a lot, right? And you were meeting that challenge. I mean, it's jumped. We saw as high as 60, I think in the mid 60s last week. Anything you want to say out to your staff as they continue to manage this surge in not just the hospitalizations, but in the deaths as well?
Well, again, the numbers are not high for the staff. They're exercising all the precautionary measures, and that we are providing them with all the PPE gear and tools and equipment and the training, updating them with all that any changes in the CDC. So, one staff getting COVID, it's again, it's not a significant number, but it is a concern when one of our employees get contracts the COVID. But again, we can't really say for sure that it was here in the hospital or in the community, out in the family, with the family. It's hard to say. But one employee versus 10 or 20, that speaks a lot that they are exercising the safety and the infection control measures. And so, again, just to emphasize, please continue to wear your mask wherever you go and keep your distance, social distance.
Has anybody died from the virus since the last deaths were announced, Lillian?
Not today, no. I haven't gotten a report of the
Okay.
COVID-related fatality.
Thank you, Lillian, for your
Thanks.
time and your update on this Monday morning. Be safe. God bless you and
You too.
GMH.
Yes.
God bless
Thank
Guam.
you for the Canada.
Yeah, take some for the staff there. There's plenty.
Bye.
Okay, bye. What?
What?
This is our little. It's the least we could do, guys. It's the least we could do. 9